So, as you mentioned, BP. Let's say we were talking about advanced valvular procedures and all. So, will BPs gonna have any impact on it? Like any failure of procedures due to, of course, the BP can be controlled. It's under your control based on medications and all. But once the patient is discharged, how
Yeah.
can the management be handled?
So that's why we always monitor the BP when the patient is inpatient. We try to adjust the medications as much as possible. We don't want to give very high doses or low doses. We don't want the BP to shoot up very high, because post procedure there will be some complications.
Because what I meant to ask is like, see, let's say BP plays a key role because you are replacing the valves, right? So obviously they are directly proportional to hook or break, right? So
Yes.
in such cases,
So we are changing the hemodynamics. If you're talking about replacing the valves or repairing the valves, so everything works on hemodynamics.
you
So
mean to say adding blood thinners?
not blood thinners. So if we are talking about the valve, if the valve got damaged, so it means
Okay,
the heart strains to pump the blood,
okay,
okay, from the valve. So when we are replacing the valve, we are replacing it with a fresh valve, a new
okay.
valve. So the heart doesn't strain. So the BP or the heart rate, whatever is there before, is will be like minimal variation will be there after the procedure. So that's why we want to monitor at least 24 to 48 hours after the procedure and adjust the medication. Some people the BP will come down, some people the BP will go up. So that's when we
Never know
monitor the
if they
initial
double
phase.
dose of medication or skip the medication in
Yeah,
such
that's why we
cases.
always ask them to monitor the heart rate and BP at least. So that's
Okay.
the basic things we ask them to do it at home.
So are there any like random complications after this valve replacements,
Random
which were
com
like absolutely unpredictable?